Recently, studies with Venetoclax in older patients with AML have demonstrated improvements in response rate and also overall survival for patients receiving Venetoclax in combination with azacitidine and also Venetoclax in combination with low-dose RSC. These are patients with AML who are treated and considered unfit for intensive chemotherapy. Venetoclax is obviously approved for use in CLL as well as AML now, and in the CLL domain, it's been found that patients who receive Venetoclax have on-target mutations in the BCL2 protein. So far, we haven't found any on-target BCL2 mutations in patients who've received Venetoclax for AML. And so the question is, are there any on-target resistance mechanisms with Venetoclax in myeloid disease? There have been some preclinical studies doing CRISPR screens looking for mechanisms of Venetoclax resistance, which have identified mutation or deficiency in the protein BAX, which is a pro-apoptotic protein downstream of BCL2. That absence of BAX leads to Venetoclax resistance. And so we looked at the BAX gene in patients who had relapsed after Venetoclax-based therapies. And we found in a cohort of 44 patients that there was a 14% incidence or frequency of BAX mutations in patients that had relapsed after receiving Venetoclax. In contrast, when we looked at a group of patients that had relapsed after conventional chemotherapy, we did not find any BAX mutations, suggesting that the mechanism of BAX-mediated resistance was specific to BH3 mimetics, such as Venetoclax. We then went on to further explore this by developing models of BAX deficiency using CRISPR and also induced resistance to BH3 mimetics, and found that BAX deficiency or BAX mutations also conferred resistance not only to the BCL2 inhibitor Venetoclax, but also an MCL1 inhibitor as well, alone or in combination. Interestingly, when we had our models of BAX deficiency, we found that there was no chemoresistance conferred by these mutations or deficiency. So this does raise the question as to how frequent and how important are these emergent BAX mutations as a cause of adaptive resistance to patients with AML receiving Venetoclax, and in addition to other mechanisms of resistance which have been identified, perhaps we can add BAX abnormalities as another cause of potential resistance to this important new therapy for patients with AML.